Okay, and now we're going to look at injury. So we're going to look at different causes of injuries, what might put us at greater risk of having an injury, and interventions that would implement when someone does have an injury. So within this unit, we're going to look at injury risk factors. We'll talk about acute versus cumulative trauma. We'll look at strategies for lowering our risk of injury, what to do in the initial stages of an injury for treatment, and we'll look at concussion, what a concussion is and how we treat it, and then for HL we'll talk about chronic and overuse injuries as well. So firstly, looking at risk factors for injury. Now, there's two groups of risk factors. Firstly, we can have internal or intrinsic risk factors, but we can also have external or extrinsic risk factors as well. So to begin with, we're looking at the internal factors. Now, this is what's within you, what makes you more at risk of injury, something that you can't really control. Maybe some of them you can, but a lot of them you can't. First one is your age. So younger athletes who are still developing, that means that their muscles and bones are more flexible and adaptable, which might decrease their risk of injury, but also that they may lack the strength or stability needed to avoid injury as well. So it's a bit of a balancing act there. And then older athletes, if we think as we grow into our old age, we might face wear and tear, especially in the joints around the knee and the hips, which might increase our risk of injury. Sex differences as well. So females have a much higher risk of ACL injuries, and that's due to differences in the anatomy mainly. So females generally have a wider pelvis, which affects the alignment of the knee and can put more stress on the knee. Hormonal differences as well might contribute to ligament strength. So females generally have weaker ligaments due to the hormones. Whether or not we've had a previous injury. So once we've had an injury, the affected area tends to be weaker and more prone to re-injury, especially if we didn't do the proper rehabilitation. But say we did do the proper rehabilitation, even after we've recovered, we can still experience these compensatory movements that can place more strain on other body parts. For example, if you had your leg in a cast for a very long time, the opposite side might have taken up more rotation or just put more strength and stability through that opposite leg, which might still be lingering there today. And when we have these discrepancies between our right and left side of the body, that's where we can really see the risk of injury increasing. So compensatory movement there. The level of training or conditioning, so athletes with higher levels of training generally are less prone to injuries as they've got better muscle strength and mobility. And then congenital or biomechanical differences. So I already touched on this. The Q angle is what I was talking about before, how women have a greater or a wider pelvis. So the angle of their quadriceps is larger, and that puts a lot of strain on the knee. So Q angle stands for quadriceps angle. Okay, and then external risk factors or extrinsic risk factors, things outside of you, things like the environmental conditions, the weather. So if it's really hot, that can lead to heat stroke. If the visibility is bad, if the terrain is super icy, these play a big role, especially in skiing. Equipment, again, another very relevant one to skiing. So if we're wearing poorly fitted equipment, like bad boots, or our bindings are no good, or we've had a few crashes in our helmet, it's not going to protect us as well as it once did. Equipment is a big one that you see, especially with running, like recreational runners, and shoes. Shoes can alter our biomechanics, so the way that we run and the way that we walk, and can lead to unnecessary stress on the joints and tissues, leading to injuries which pop up. Other athletes and collisions. So if you're in a contact sport, we need to be aware of our surroundings and where other athletes are, especially for skiing. If you're skiing down a busy piste, it's a major cause of injury, just other people, other hazards being in the way. And then the type and intensity of activity as well. So if we've had an injury, let's say, or we've taken a few months off training and then we suddenly jump back into it, full blast, that's when you can overwhelm the body's capacity to adapt and have an injury there. So gradual increase in training load is always very important and essential for injury prevention. Okay, to look at some different types of trauma or different types of injuries, we have acute trauma. This is a sudden injury from a high impact event, high force injury. Think of it as like one big hit. It can be very serious. It can lead to a broken bone or an ACL tear during a fall. Whereas a cumulative trauma or cumulative injury is an injury that builds up over time due to repeated stress. So it's more like little hits over time. Often a result of poor technique or overuse. They can be a bit harder to spot because the damage accumulates gradually, and it can lead to long-term conditions like shin splints from overtraining, a tendinitis in your Achilles, or even stress fractures in your feet. So both are quite serious, but an acute injury happens in one go, whereas a cumulative injury or an overuse injury builds up over time. Now, some strategies to lower our risk of injury are firstly equipment, protective equipment. So helmets, back protectors, wrist guards, mouth guards, you'll see people use in contact sports. These can reduce our risk of injury. Helmets might also slightly reduce the risk of concussion, but not fully. And we'll talk about concussion a lot more later on. Making sure the equipment is adjusted for the athlete, so considering different body shapes and sizes, especially with something like helmets, if it doesn't fit you, it's not going to do much in terms of protection. Ensuring we have a good warm-up and prehab sort of training in place. So doing some flexibility training, some dynamic stretches, some mobility, some strength and joint activation is really important for reducing our risk of injury. So strength and conditioning, especially in the pre-season, helps to support our muscles and build strength within our muscles to help maintain a good sort of body function and make injuries less likely. Now, finally, technique and rules. So technique is super, super important. The foundation of injury prevention is technique. We need to learn how to maintain good technique, because bad form in any sport or in resistance training can put unnecessary stress on our muscles and joints and ligaments, leading to an injury over time. And then also considering the rules for different age groups. In contact sports for very young kids, they will have no contact rules until they get to an age where their bodies can handle that contact better. Now, when we do sustain an injury, our initial stages of treatment are all about controlling pain and inflammation. When we have too much inflammation, that can delay the healing and increase the discomfort and pain and swelling and stiffness. So we really want to bring down the inflammation straight away. The method for that is the RICE method. You might have heard of it before: rest, ice, compression, and elevation. So resting the injured part of the body prevents further stress, allows the healing process to start. Ice is very good for reducing swelling, and it also numbs the area to ease pain and prevent further tissue damage. Now, compression, so using a bandage or a wrap around an injury site, can reduce the swelling by applying some pressure to the injured area. It also helps to reduce the amount of blood flow going to that injured area, which you might think is good, but actually in the initial stages, more blood can mean more pain and more bruising. So some compression is quite good. And then we have elevation. So elevating the injury above the level of the heart helps to drain the fluid and swelling away from the area. And finally, we have NSAIDs. These are non-steroidal anti-inflammatory drugs like ibuprofen, which can alleviate both the pain and the swelling, but they should be used sparingly. and then also possible immobilization. So if we need to keep the site of injury stable, we could need to immobilize the site of injury, and that could involve something like a splint or a brace or even a cast, depending on how severe the injury is. Okay. Now, concussion. So we're going to talk a bit about concussion within this unit. It's a type of brain injury that occurs after a blow to the head or to the body. So you don't necessarily have to be hit in the head for a concussion to occur. If you're hit in the body hard enough, it will still cause that shaking of your brain within the skull, which is how a concussion happens. Also, it can happen with or without a loss of consciousness. So a really severe concussion will mean that you lose consciousness, but you can definitely still have concussions without a loss of consciousness. It's 90% of concussions happen without the person falling unconscious. The immediate symptoms of a concussion are quite varied, but for the most part they involve a headache, dizziness, brain fog, confusion, and vision changes. On the severe side of that, we can have vomiting as well. And the long-term consequences of concussions are really severe. They can cause serious brain conditions like chronic traumatic encephalopathy, which is linked to memory loss and mood swings. And they can also lead to Alzheimer's and Parkinson's disease as well. I've got 2 videos for you to watch on concussion. The first one just goes over the mechanisms of concussion and how concussion actually affects the brain. And the second one looks at the effects of repeated concussions, the long-term serious consequences of concussions. Now, in order to reduce the risk of a concussion, there's a few things that we can do. Firstly, wearing a properly fitted helmet. Helmets do help reduce the risk of concussion, but not fully, because a concussion occurs when the brain moves within the skull. Now, a helmet protects the bone of the skull, but it doesn't stop the brain from moving inside. Think of the brain as like jelly within the skull. It will move back and forth, even if there's a helmet on. But you might want to use a helmet that has the MIPS technology, which can help with the sort of rotational forces on the brain. And when we have a concussion that involves some rotation of the head, that's a more serious concussion because it affects the brainstem, and that's often when people lose consciousness. You want to use safe techniques, so learning how to fall and avoiding head-first contact with the ground, following age-appropriate rules we've spoken about before, so scaled rules and design of different courses and contact levels. Educate athletes and coaches, so knowing the symptoms of concussion and encouraging reporting of concussion and rest. And then also managing fatigue. So if you're tired, you're going to have a slower reaction that might lead to a higher risk of concussion if you do fall. In order to assess the concussion, there is widely used tools, particularly the tool called SCAT-6. It's very, very long, much longer than these 2 pages, but it's used in sports like rugby, NFL, skiing, football, and lots more. It involves a checklist of symptoms like headache, nausea, balance. It involves a cognitive assessment, so this is like a brain function assessment looking at orientation and memory, and it involves balance and coordination tests as well. In order to return to sport following a concussion, we can follow this sort of 7-step system. One is complete rest, no physical activity, no school, and no screens. Step 2 is symptom-limited activity, so short walks and light chores. If you have any symptoms, you need to return back to the next level. Step 3 is light aerobic exercise, so we're increasing the heart rate. 4 is sport-specific exercise, so you can return to a little bit of training, but especially no contact and no head impact. 5 is, again, no contact training drills, so we're thinking about things like coordination, reaction time, doing agility and strength training as well. 6 is full contact practice, but you must have medical clearance before moving on to this stage. And then 7 is a full return to sport. So it's a gradual approach that ensures the athlete is fully recovered before returning to full activity and helping to prevent further harm. Okay, for HL now, we've got a little bit more to look at on chronic and overuse injuries. These are injuries, again, that develop over time due to repetitive stress, poor technique, or bad recovery. An example of a chronic or overuse injury is patellofemoral pain syndrome, which is pain around the knee. It's often from overuse or poor knee alignment. Shin splints is also an overuse injury. It's pain in the front of your lower leg, normally from repetitive impact, often running. And then lower back pain and tendinopathies. So tendinopathies in the knee or in the Achilles tendon is like a chronic pain in the tendon, typically caused by repetitive movement without enough rest. So acute injuries happen suddenly, and they are often due to high impact events or accidents. Whereas chronic injuries are more gradual and develop over time due to repeated stress or overuse, often because of poor technique or biomechanical flaws. So the key factors that cause overuse injury is biomechanical maladaptations. The IB likes to use this terminology. It basically means poor technique or muscle imbalances, or limited joint mobility, anything that biomechanically isn't quite right. Poor technique, again, inadequate rest and recovery, so not having enough rest and allowing our muscles and tissues to repair leads to that accumulation of stress and makes the body more susceptible to injury. A big sudden increase in training load, so again jumping into something more intense and high volume after a period of rest too quickly, it can overwhelm the body's ability to adapt. Equipment issues and repeating bad movement patterns, so using poor technique over and over again, placing some uneven stress on your muscles and your joints, gradually leading to an overuse injury. So again, biomechanical maladaptation, again, is a faulty movement pattern that puts excessive stress on joints or muscles, and it can result from any of these things that I've just spoken about. In order to avoid an overuse injury, prevention is always better than treatment in this case. So you want to do regular mobility and strength checks, ensuring that you've correctly periodized the load of the training that you're doing, volume and intensity for a gradual increase in load, that you're getting coaching feedback and correct technique early on in your training, and correcting any biomechanical maladaptations that you may have. In terms of returning to sport after an overuse injury, it's a gradual return and you're monitoring for any reoccurring pain.